Good evening, everybody. Welcome to our second webinar in our series of educating people and creating hopefully some greater understanding of health, some greater understanding of biological medicine, some greater understanding of a way to approach specific health challenges that people have. This evening, we're going to focus our attention on the endocrine system. Um, Hopefully you were with us a month ago when we did our first talk on biological medicine. And remember that one of the key things that we do in biological medicine is our focus is not to treat patients' symptoms or signs. And as we'll see this evening, people who have imbalances within their endocrine system have lots of signs and symptoms. And the endocrine system is but one of many systems that we focus on. However, it's impossible to talk about every organ system, in every webinar. So, as we go through this, we're going to break it down. And next month, during our monthly presentation, we're going to be talking about the immune system, how the immune system affects autoimmune disease, how the immune system affects colds and flus, how the immune system affects allergies, how the immune system affects cancer, and how do we strengthen our immune system if that's what we should be doing, and how does the immune system get out of balance, et cetera, et cetera. But that's going to be next month. So this month, as I said, we're going to focus on the endocrine system. Hopefully you are at least familiar with the idea that the endocrine system is made up of a number of different glands. We won't call them organs, we'll call them glands. This particular slide shows you, the most common ones that are present. So people who have an endocrine problem often end up in an endocrinologist's office to look at these particular areas. We are not going to talk about all of them simply because it's way too complex a system to do that. But this just shows you where the endocrine system is located throughout the body. We have parts of it that are in the head, parts of it that are in the neck, parts of that are in the intestine, parts of that are in the genitalia area, etc. So it's not in a specific place, unlike our organ system where we say the brain is in the head, etc. So we're going to break it down and talk about it more specifically, individual parts. So what does the endocrine system do? It releases compounds that we call hormones into the bloodstream, and generally very rapidly. In many cases, almost within seconds, they are transported throughout the body into the specific organ or the specific receptor, I should say. But in order for the cell or the organ to respond to whatever that hormone is, there has to be what we call a hormone receptor. So every cell in our body doesn't respond to every hormone because that's not the function of that particular cell or organ in order to do that. So we're going to look at that type of a model, and here we see a little picture of on the extreme left it says the targets for hormone A, and you see there's a specific shape, we'll say, and hormone A only fits into those receptors that are on those specific cells, sort of like a lock and key does. On the extreme right is B, hormone B. So hormone A coming along will not support the cell where hormone B fits, but then there are some target cells that have hormones for A and B. So that's how the body works. So the endocrine system is responsible for many common effects. The most common one, of course, being our growth and development, starting with babies. It is the responsibility of the endocrine system to secrete specific material, hormones, male and female, how our body uses energy, how our body burns and makes sugars, the volume of fluid that's in our body regulated by our kidney, and our appetite is certainly controlled by that also. So it has a whole many functions. In fact, most cells in our body respond on some level to a hormone in some specific capacity. So these are some of the more common effects that you are probably familiar with as far as what the hormones are capable of doing. At the top, you see that says the pituitary, which regulates all the endocrine glands and releases hormones. So that's sort of what the standard approach is. But as we go through this, I'm going to share with you that is not my belief. I do not believe the pituitary is at the top of the totem pole. I believe there's another gland that's actually at the top of the totem pole. So I call a different gland, which we'll talk about shortly, as the master, and then the pituitary is sort of a little bit downstream. Most people are very familiar with their thyroid gland. It is probably one of the most common dysregulated organs or glands, excuse me, in our system. Upwards of 40% of the population at some time within their lifetime will be told that they have a goiter or a swelling or a cyst in their thyroid gland. There's a very common condition called Hashimoto's thyroiditis, which is autoimmune disease, which is one of the more common autoimmune diseases that people have. Parathyroids sit beside the thyroid in the neck. There's 4 of those little glands. They control your calcium metabolism. Hypothalamus is up in the brain. The adrenal gland will share a little bit more information. People with blood sugar dysregulations, the pancreas is responsible for that. Pancreas has actually 2 functions. One is to help digestion, and another is to secrete hormone to help regulate blood sugar. Of course, women are familiar with their ovaries, the release of estrogen and progesterone for menstrual cycles, and males, it's the testes, and the thymus, which is a part of the immune system. So once again, these glands are all over the body. They have numerous functions. So the biggest thing with hormones, as this little picture suggests, is you can either be really happy or really upset. And hormones in balance is what we're after. And it's not just a hormone, it's how do we look at these in context of multiple hormones as we're trying to balance multiple things. And one of the things I feel strongly about in biological medicine, we don't just say, oh, your thyroid is off, so here, take thyroid support, whether it's a glandular support, vitamin and mineral support, whether it's a natural thyroid hormone, Nature-Throid, Westroid, etc., or it's a synthetic hormone replacement. Those can support the thyroid, but they won't really deal with how the hormones are out of balance. What we do know about the endocrine system, and we do know about people who go and see a physician, whether it's about their endocrine system or whatever, most people are perceived to be, or will self-report that they feel stressed out, sort of in the life that we live. It's certainly a challenge to be able to do that, and they're in a hurry to do something, thinking that whatever it is they're doing is what will make them happy. Unfortunately, that lifestyle of being stressed very commonly leads to chronic disease, most commonly diagnosed in women who are over 40 and men who are over 50. And usually in that patient population, as I talked about last session, involved in that session of why a chronic disease develops is going to be an imbalance in their endocrine system. It may be their adrenal gland, it may be their thyroid, it may be an ovary, a testes, or maybe any of the other ones we basically have shown you. And it often comes from, the activation of some underlying problem that's basically inexistent. One of the things that's important, if you, as you read this slide, is to realize that when hormones are out of balance, they exacerbate, they increase the rate with which various signs and symptoms start to appear for people. So women who are postmenopause will often have a DEXA scan and say, oh, you have osteopenia or you have osteoporosis, not realizing that that condition started 30 or 40 years before somebody suggested that they have a DEXA scan. Blood vessel disease, we know that arterial sclerosis and heart disease is something that tends to occur in, once again, people 40 or 50 or older. Not that you can't have it younger. People start to shrink as we get older, and it's a collapsing of the spinal cord. the collapsing of the support systems. We know the organ functions don't work well. We know mental functions are not quite up to snuff. People feel that their muscles are weaker, et cetera, et cetera. So those are classic type presentations that people come to the doctor about, and they're sort of looking for what's the magic bullet that will correct that. But as we'll see, there's no magic bullet, because our real goal is to try and find out, what is the problem. And so those symptoms and conditions that I just listed are not the cause of the problem. They're the consequence of hormones being out of balance. And so what we always want to try and do is try and help somebody understand, but why are they out of balance? What is it that's happening that we need to be able to do to try and get this whole endocrine system in balance? And my belief isn't it's just like, oh, here, take your thyroid is low, take thyroid hormone. Your estrogen or progesterone or your testosterone is low, here, inject testosterone or use testosterone gel or take a bioidentical hormone. Those can be supportive, and they're not that they shouldn't be necessary, but they still don't answer the problem. Why, if the body is designed to be able to maintain adequate hormone levels throughout our lifetime, and whether we're 10 years old or 100 years old, why do we not have adequate levels of hormones? So, I mean, that's really the focus that biological medicine attempts to take when we're trying to address and make an assessment of an individual as to where their specific situation is. So I've just listed a few what we call the common triggers for hormone issues and hormone imbalance. I already mentioned that stress is without doubt probably one of the more common aspects. We do know that stress affects cortisol level, and stress is a relative thing, and hopefully many of you listening this evening will be coming to Louisville in a few weeks. And one of the presentations I'll be doing in Louisville is specifically on stress and how all stress isn't bad. And in fact, stress may be something that you, in a controlled way, you want in your life, because it actually can prolong and enhance your sense of well-being. So stress is a component. Our eating habits, and the biggest thing about eating habits that puts a balance, stress on your hormone system, is not having regular meals. So not ideally eating at the same time each day, more or less, I'll say within an hour of each other, breakfast, lunch, dinner. Not really eating in the evening, not eating 3 hours before you go to bed, that type of thing. We typically want to eat, breakfast is for the king, lunch is for the queen, and dinner is for the pauper. Is physiologically the way our hormones work the best. That is totally the opposite of what our society has. In fact, it's the other way. Usually it's, the king for dinner, the queen for lunch, and the pauper for breakfast. But if we truly are looking at hormone balance, that's one of the things we have to be mindful of. The toxicity underlies virtually every chronic problem because it creates chronic inflammation for people. Toxicity isn't just about a pesticide or insecticide. It's emotional toxicity as well as physical toxicity that leads to these imbalances. Microbes have been around forever, as we know, and whether we call it Lyme disease, which is a bacterial type issue, or more commonly historically, we find that it's viruses that have come into play that can create and contribute to these hormone imbalances. Certainly acute trauma, being in a motor vehicle accident, having your body injured in some way, in a motor vehicle accident, in an industrial accident, in a work environment, etc. Chiropractic looks at the whole idea of, they'll call it subluxation, where there's an imbalance of, how the spinal nerves come out from the spine and then innervate all the body parts. Geopathic stressors. There's probably a little bit more information that people are aware of, but you should be aware of that the entire Earth is surrounded with literally a big grid, sort of like a checkerboard. I don't know how many feet apart the grid lines are. So they basically makes the whole Earth covered with, as I said, what amounts to this grid that's several feet off the ground. So if you have a cat that likes to sleep on your bed, especially with the cat wants to sleep where your head is, the suggestion is change the position of your bed, because they usually like to sleep where there's a crossing of the grid lines. And you don't want to sleep there because there's a lot of energetic interference. So the goal is to, if we have these grids, is to sort of sleep between the grids, so we're not overlying one of these grid lines. So one of the things, if your sleep is less than ideal, one of the things you can do is, if it's possible, based on your bedroom and things, is to change the rotation of the bed 90 degrees. See if you sleep better just from the rotation of that, because of the energy that's associated with that. Chronic inflammation is sort of underlying all chronic disease. Surgery is the removal of an organ will definitely create an imbalance in hormones. Allergies can do that, and iatrogenic, unfortunately, are sort of doctor-caused problems where they do something, give something, the wrong medication, an adverse reaction to a medication that can definitely have a negative effect. So if we're going to talk about hormones, it's important that we figure out, well, how do we test these things? And what are we looking for? This is just an example of one of the hormones, specifically cortisol. So in a typical day, these hormones are produced within our adrenal gland, DHEA. I'll talk just a tad more about them in a bit. Cortisol and aldosterone, and they all have different functions, important functions. So we know with a normal stress response being physical, emotional, spiritual, factor that can cause it. So when your body is exposed to stress, and stress is the reason the body reacts is so that basically it can return to balance, because there is this rise of cortisol that has a whole bunch of functions that allows us to deal with the stress, and then the goal is, as the stress winds down, so does the hormone, so we see that shut on, shut off. That's what's supposed to happen. Another thing that's important when we think about the whole idea of hormones is that there is a circadian rhythm. The hormones they never have a steady state. They go up, they go down, they go up, they go down, and different hormones have literally a different circadian rhythm that it's a very major impact that I don't think we pay enough attention to. Especially when we're doing support to support the endocrine system. So I'll pay attention to the bottom one down in the bottom right, where it says growth hormone. Growth hormone, that the shaded line, depending what you're viewing this webinar on, is representing the early hours of the night. So you see growth hormone peaks, we'll say 12, 1, 2 a.m., somewhere in that range. And you see melatonin also, ideally, which is at the top of there, peaks. But what you also see is at the same time cortisol is at its lowest level. So when growth hormone is up, cortisol is down. Melatonin is up, cortisol is down. So they're opposite circadian rhythms for obviously very important reasons. So we see that if you're sleeping well, you get a great response for growth hormone. If you're not sleeping well, you do not get a good response to growth hormone, and growth hormone is responsible for healing. So when people do not sleep well, it's much, much, much more difficult for them to heal. It's much more difficult for them to start to feel better, because their rhythm is totally disrupted. And we said, if you have basically just a wee little curve from growth hormone and do not get that spike and that peak, any healing that happens that night is going to be majorly disrupted. So circadian rhythm is particularly important. These are ways from a biological medicine perspective that we measure hormones. The conventional model and often an endocrinologist will only use the very first one, called the blood test. But we can do a blood spot, saliva and blood, urine, blood, and I just listed a couple of the labs that we use in our clinic. So saliva has been shown back. This one I've been using it certainly since the 80s. So for the last 30 years, we've known that saliva is a very accurate and a very effective way to collect hormones. It doesn't involve a blood draw. Involves literally spitting in a little vial. The saliva is stable as far as hormones are concerned for some time. It's easy to get it to the lab and have the lab run a test and give us a report. Unfortunately, with serum, and one of the advantages of saliva, of course, is you can do it at different times in the day, and you can get what is the rhythm, trying to follow the natural circadian rhythm that somebody has. can also measure things in the serum. We can also measure it in the urine using 4 different samples. So if we were to look at the natural and the normal circadian rhythm, this one's cortisol, the red line is sort of right down the middle of the 2 blue lines are representing sort of the highs and the lows as far as reference ranges. And if you look at it, and sort of it's like a sort of a recliner chair. So your cortisol levels are supposed to be highest in the morning. They drop somewhat towards noon, and then level off to the afternoon, and then drop to the evening, and then from midnight up until the morning again, they start to go up again. That's exactly the type of rhythm we're looking for. And if it's not that rhythm, then that hormone system is going to be out of balance. So this is a typical lab. You see in this particular case, the green is representing of the reference range. However, you see in this particular person that the blue line is below the green, except for the nighttime one. So this person would say they're exhausted, they're really tired, but they try to go to bed and they have trouble going to sleep because their nighttime cortisol is so elevated. And it's like the nighttime cortisol is almost as high as the morning cortisol. So the body's saying, well, what are you doing going to bed? You're supposed to be getting up and doing things. But yet this person at noon in the afternoon are dragging through. They're like, oh my God, how do I get through the afternoon? Where's that green tea? Where's that cup of coffee? Where's that, that big red or whatever they call that boost, that, caffeine? Let's use a stimulant of some type to jack it up. In addition to that, you see the bottom part of that graph, a DHEA, and it's way down in the bottom left corner in that little, it's number 7 square. And then if you look over, at the at the key, number 7 means this person is in adrenal fatigue. So we get that information simply by collecting 4 different saliva samples taken in the morning, around noon, late afternoon, and then at bedtime, and we were able to get that. This is a graph that allows a woman to graph her hormones during her menstrual cycle. It's very valuable for women who have either irregular menses or a lot of cramping or spotting, or it's 1 month, it's 22 days, and then it's 31 days, and then it's 28 days, and then it's 40 days, or it's heavy or light or spots, whatever. And this one also is a sample, saliva sample, that's taken every 2 or 3 days over the course of the entire menstrual cycle. If you were to do this this particular test to get that particular graph by a blood test, it would cost you about $3,000 to go in every 2 or 3 days, as well as the inconvenience, and have these hormones measured throughout the month, probably 11 or 12 times throughout the month. But by doing a saliva test at home, the woman can basically chart her hormones, follow it, and the ideal is that's what it should look like. The green is representing estrogen. The red line is representing progesterone. So we see 2 estrogen peaks, 1 progesterone peak, and then you see towards the end of the cycle, we have a precipitous drop of both estrogen and progesterone. That's what causes a sloughing of the lining of the uterus, and the woman has her menstrual cycle. But this type of a test gives you some really good information. This is sort of the newest kid on the block. It's the Dutch test. It allows you collecting, or not collecting, but literally urinating on a strip 4 different times of the day. We're also able to see a cyclical pattern that goes with that. And you see that, saliva gives you good information. Blood is very minimal, just the basic hormones. 24-hour gives you information, but this obviously gives us something, and then we get a graph that looks something like that. So it's just another way for us to try and help people understand things. One of the specific things when we look at the cortisol is that right in the middle, you see it says cortisol to DHEA ratio. I mentioned earlier in that first case where it said, when your cortisol and the DHEA ratio is off, it can cause a whole host of variety of symptoms. And in fact, just looking at this one slide, if we were to go around and look at each of the different components, it would probably necessitate an individual going to 5 or 6 different doctors looking for one problem, and nobody will identify it. as being an imbalance in their endocrine system, specifically in their cortisol to DHEA ratios. In fact, many times DHEA isn't even measured if somebody is looking at their cortisol, even by an endocrinologist, because that's not really what they hone in on. They're simply looking, you have too little cortisol, you have too much cortisol. Who cares if it's relative to DHEA or not? But the research has shown, all these different signs and symptoms have shown that that particular ratio is critical to the success. On the left, you see, and it's no accident that all those smiley faces are smiling. So we tend to think of nice thoughts when we have adequate levels of DHEA hormones. Not so happy faces when we look at the cortisol side of of that particular slide themselves. So it's the balance that's important, because we need both. We don't want too much cortisol. We don't want too much DHEA. We want the things to be in the proper balance in general. So here we see the ratio. This is another ideal scan from the red line, sort of between the dots there. And we see the ratio at 5 to 6. This is what a normal scan should be. This is one where you see the ratio is 245, which is like, okay, this is way off. So it's like, you can say, oh, well, you have virtually no cortisol, so we'll just give you cortisol, which often is what an endocrinologist would do. The person says, well, I think I feel better, but they won't get better, because until you correct the ratio of the DHEA to cortisol, you're just going to be palliating. And people say, well, yeah, but how much more of this steroid hormone do I have to take? And why do I still not feel ideal? And you're not ideal because the ratio is not good. One thing when treating this component of the endocrine system, specifically the adrenal, is you really need to be patient, because it took years in most cases for the adrenal gland to be weaned down to the point where, like that one I showed you with in adrenal fatigue that people have. And it can take up to a couple of years to literally build it back up again, because the adrenal gland is an organ that's used every single day. Our body needs it. It's our stress hormones. So based on how we are, so we would hope that during vacation, we could build some back up, so the vacation isn't stressful. On weekends, we can build things up. We do things that are fun. In the evening, we relax. We do our job. We come home. We're able to recover. But we have to be patient about that. So if we're looking at achieving an ideal balance of all these hormones, not just the adrenal and the cortisol and the DHEA, I basically suggest that we need to be looking at 6 different components to make a decision about whether or not how we want to support an individual patient who may have a specific problem. So the pineal, hypothalamus, the pituitary, the specific gland transport and receptors. And there is a suggestion through typical research in medicine that up to 80% of women and 60% of men have a hormone issue. And they go looking for some magic bullet, and often, unfortunately, the challenge is it's not just one organ, or one gland. You have to look at multiple. So once again, these are what we call our major players. I put them out here in just a little bit different presentation. You see, instead of now the pituitary being top of this totem pole, we have the pineal gland, hypothalamus, pituitary, and then all that feeds downstream to not just the adrenal, thyroid, and ovary, but those are the key ones that we're going to focus a little bit of our attention on. So the interesting thing about the pineal gland, this is the one I believe is the true master gland. This is the one that is really controlling everything. This is the gland that controls our natural circadian rhythm that people have. It's if you can see on your picture, it's right dead center in the middle of the brain. If you divided the brain this way and this way, dead center, is the pineal gland. So it's almost buried deep within the brain. What's interesting about the pineal gland, what's interesting from, what do conventional medicine doctors think about the pineal gland? Unfortunately, very often it's used for not the right purpose. You see that, where I have the arrow pointing is this white bleb. That is the pineal gland that has become calcified. It's radiopaque. And when it's radiopaque like that, if somebody has a brain tumor or a brain mass or a brain bleed, they often will reference the calcified pineal gland as it's 2 centimeters from the pineal gland, or it's 4 centimeters from the pineal gland, because obviously that gland's not moving. And you know, when they do serial pictures over months, you can see whether or not the mass is getting smaller or bigger, or what it is relative to this measurement. It's very, very sad, however, that nobody ever says, I wonder why that pineal gland is calcified. It's not supposed to be calcified. And to get a really, really good understanding of this gland, if you go to that particular YouTube, healthy-holistic-living.com/third/I-kiss.html, you will get a really good understanding of the importance of this so-called third eye, and why we don't pay enough attention to it, and why we need to. But of course, biological medicine will, because the #1 treatment of the pineal gland is to sleep in total darkness, because dark is what turns the gland on. So, and if you can't get your bedroom pitch black because of, you know, skylights or whatever, then you should be wearing an eye mask. And then of course, if that turns the gland on, what turns the gland off is sunshine. I of course live in Arizona. I live in a very, you know, place that sunshine is not at a premium. We have over 300 days of sunshine, just like today, where it's incredibly warm here today, even though it's still April. But so we turn it on with in the dark, and we turn it off with the light. People who live in higher latitudes, whether it's in England or in Canada, or, you know, up in Alaska, forever it's dark. Sometimes you need what we call an awake light to mimic the whole idea of the sun coming up over the horizon. So if the job and life necessitates you're up at 6:30, let's say, in the morning, or 7 o'clock, then the awake light starts to come on about 30 minutes before the time that you technically need to get up. It's a great supportive treatment. So dark is easier, night mask if necessary. Light is a little more challenging. But anyway, that's how we support the pineal gland. And the most common symptom related to the endocrine system is what we call low metabolic injury, or alternatively fatigue, which is the term that, you know, most people will refer to as, oh, I'm so tired. And we're going to look at 4 simple ways that is possible. Adrenal, that we've been chatting about, thyroid also, toxicity, and then even vitamin deficiencies can be a problem for people. So I'm going to break it down to the simplest, and that's these 3 organs. Once again, these are not the only 3 endocrine glands, but they are the most commonly supported, where adrenal, thyroid, and ovary, testes are literally the 3 legs of a stool. So when the adrenal gland gets really fatigued, like that example I showed you, the body says, oh, how am I going to get this energy? At that point, it will try and recruit the thyroid, because the thyroid is also responsible for energy, making metabolic energy, you know, that type of thing. So, and then the other, of course, is the ovary. It says, well, can I get anything out of the ovary? So what starts to happen, and when one gland is out of balance, the other glands start to try and compensate, and they become out of balance. What's quite interesting statistically, the aspect of, in a postmenopausal woman, obviously her ovary no longer serves much of a function. It doesn't produce adequate levels of estrogen and progesterone, you know, that's going on. So the adrenal gland and the thyroid gland have to then take over the work that the ovary was doing. Mostly it's the adrenal that basically has to make this estrogen and progesterone. And even in a postmenopausal woman, you know, she has 200 plus receptors for those hormones. And of course, that's why bioidentical hormones have become so popular. Oh my God, I don't have my own estrogen, progesterone. Let's just give it externally, and that'll solve my problem. But it doesn't correct the problem, because in reality, if things are in balance moving into menopause, the adrenal and the thyroid are more than happy and able to do that. However, many postmenopausal women, as they move into that particular stage of their life, typically in this society about 52 is the average, but it could be 35 or it could be 58. But 52 is sort of the average now in our society. So it's always of interest that the most common age that people are diagnosed with low adrenal function, even though it's every age, is postmenopausal women. And you say, well, how's that possible? It's because the ovary doesn't do its job. The thyroid is trying to take over and it can't keep up, so it goes into hypofunctioning. I never believe you can treat one organ without treating the other ones. So even women who take bioidentical hormones, thinking that that's going to solve their estrogen, progesterone, perhaps testosterone issues, should be having their adrenal and their thyroid supported in some way. Otherwise, we're just going to further imbalance those specific hormones also. And for those who are not familiar, the adrenal gland itself sits right on top of your kidney. They're not very big. There's one on each kidney to do these important functions. I only show you this particular slide because most people always think of cholesterol as being something that's bad. But it isn't bad, because without cholesterol, you would have no hormones. This is sort of a downward schematic. The original, or the backbone of every single hormone in your body is cholesterol. If you lower your cholesterol too much, when you get to the bottom of this graph, aldosterone, cortisol, testosterone, progesterone, etc., you're not going to have enough cholesterol to make adequate levels of hormone, which by itself creates a problem. So people think, well, I'll just give you the hormone. But it doesn't correct the problem. And, you know, we have this common idea that we should have low cholesterol. Somehow it's related to heart disease. And at some level, yeah, there is a component there. But for the most part, it's not the problem. If we were to go back to 1900, you know, people had 200, their cholesterol level was 200, or excuse me, 250. Now we say, oh my God, if it's over 200, it's a problem. Now if LDL is over 100, it's a problem. However, they were eating lard and, you know, eating straight bacon fat and all that kind of stuff. And that wasn't the problem back in the day. Cholesterol is not the issue. It's how the body metabolizes things in general. So know that just because somebody has you on a statin or recommends that, that may or may not be okay as far as your hormones are concerned. When we're looking at basal body temperature, specifically related to the adrenal, we're going to see that there's a rhythm. And this is just a graph to show that at nighttime, our body gets a lot chillier, a lot colder. You know, we have 98.6 put to 0.8, somewhere in that reference range. That is the normal body temperature. And the reason it's normal is because that's the temperature which our enzyme systems will work the most efficiently, which is why we want it to be 98.6. But knowing at nighttime, it goes down. So when it's all over the board like this, so this is somebody taking their, you know, their basal body temperature. You see the very first one says it's a 97.0, and then the next day it's 98.2, and then it drops to 97.3, and then, you know, as we move over, it's 98.5, and it's like it's like a zigzag. That is the typical picture for somebody who has a thyroid problem. A thyroid, and excuse me, wrong. This is the typical picture that for an adrenal problem. I'll show you one for a thyroid in a minute. So when it's up and down like that, and people say, "Oh, I have a low morning basal body temperature," that's a problem. My thyroid, and because I can't lose weight because I'm constipated, because my skin is dry, or I've dysmenorrhea, or I can't think, focus, my thyroid must be off. Usually not if it's this type of a pattern. And so you see what happened, you know, at the start of the yellow line, there was some starting of adrenal support. And then you see over time, the range got smaller and smaller, and gradually, as the adrenal gland became stronger, it normalized its temperature. Excuse me. So when the cortisol is out of balance, Man, look at that list of all those symptoms. And it's like, it's hard to have almost any woman who's not feeling great list a number of those problems, whether it's high or low cortisol, and you see some of them are on both sides. So if you have low, it's fatigue. If it's high, it's fatigue. If it's low, it's insomnia. If it's high, it's insomnia. So you can't just say because I have fatigue, and I must have low thyroid. Anything on that particular level, that's particularly a problem. So both the problems there that exist can come from either high or low factors. So what do we do about the adrenal gland? The number one treatment of the adrenal gland is sort of like sleeping in the dark, is to have a regular routine. Getting up in the morning, going to work on a regular schedule, eating your meals at a regular time, and going to bed at a regular time. Those are the critical components that will help your brain and your adrenal glands sort of get into a regular pattern. And in addition to that, we do some other types of support, such as, we call them all the basics. So drinking adequate amounts of water, B vitamins is something that's particularly helpful. Essential fatty acids, minerals are important, some vitamins, and those come down to the specifics that you have, individually for a person, for what's going on in general. So, I mean, that will be supported by, by your physician or your therapist, whoever you're talking to specifically about hormone stuff. DHEA is another one that not many people pay as much attention to. However, people who do anti-aging type stuff will realize that DHEA is the so-called anti-aging hormone because it naturally does decrease after the 20s and 30s as time goes down, because it's literally trying to stay in balance with our cortisol levels. Remember, it's all about a ratio. So we see a number of things listed there that are the functions that DHEA has the benefit of helping and doing for what's going on. And this is how typically I will prescribe DHEA, and it's very low dose. Generally, people that I find who are on DHEA are on way too high dose. It just further imbalances their cortisol DHEA ratio. And what we do is we use just single tablet or capsule, 5 milligrams per capsule. So week one, we're doing 1 capsule, week two, 2 capsules, we add 1 capsule. And what's interesting is most people will find that by the time they're at week 3, sometimes even week 2, that's all they need. They don't need 50 milligrams. They don't need 150 milligrams, which is way, way, way overdosing it, which causes its own set of problems. And the interesting thing about dosing DHEA, when you have too much, in addition to potentially causing male hair growth and acne, the number one symptom clinically that people will have is increased fatigue. The very thing we're giving it for is it goes like you go to the top of the hill and now you start going down the hill again. So it actually is a detriment to overdo it. Pregnenolone, interestingly, is a hormone which, if you remember back from that graphic, showed you sort of just underneath cortisol. It's way, way up in the chain of how the body makes hormones. This was used back in the 1940s before they had so-called standardized thyroid or cortisol or prednisone or whatever. I'm gonna have to find a cough drop here. Excuse me. So this also is a hormone that can be utilized and is useful to support people by treating upstream. And when we treat upstream, what we're not trying to do is we're not trying to replace the hormone, trying to get the body to make its own hormone, so we don't have to end up going downstream and saying, oh, here, take these bioidentical hormones, because that's saying this is exactly the amount you need, and there's no possible way any doctor would ever know that this is the right amount of hormone that you need. It's just a way of, this is once again showing the cortisol pregnenolone. And this is a condition called the pregnenolone cortisol, and depending on this ratio of cortisol and DHEA, we can push things in the wrong direction. You see, we can push it towards more estrogen, which may not be where you want it to go. We can push it towards more cortisol if that's where you want it to go. So enough to be said about cortisol in a brief. Let's look at thyroid. You're probably familiar that your thyroid lies just around your Adam's apple. Easier in a man to feel than in women. You see, it's sort of the shape of an H. There we have these two glands connected by the isthmus that's going on. To test thyroid hormone, serum is definitely a standard. Has been used forever. Unfortunately, what's often done when testing thyroid values is depending who's making a test, and with doctor, you're saying you may not be checking all what you really need to check. So biological medicine, the minimum things we need, once again, is a three-legged stool, is TSH, free T4, and free T3. Those are sort of the three corners of a three-legged stool. And if you're only doing TSH, which often is done, unfortunately, all we're doing is testing one leg of the stool. Does not tell you much about function of the thyroid at all, and it really it's totally insufficient as to what truly is going on. But if we're investigating, we're also going to do antibodies, TBO antibodies. Reverse T3 is another thing that can block receptors. And because there's such a common overlap with gluten sensitivity, celiac disease, gluten challenges, often a test for gluten should be included, and certainly vitamin D. So that's sort of a much more complete way to evaluate thyroid hormone as opposed to just checking, one hormone. So the thyroid gland, as this slide suggests, makes about 100 micrograms of T4. And T4, however, doesn't do much. It's the raw material for the active hormone, which you see in the bottom. It says T3 is the active hormone. So the thyroid gland itself makes a very minimal amount of active hormone. 100 micrograms of the T4, but only 6 micrograms of the T3. So you see the ratio is about 14:1 in the gland. But if the T3 is the active hormone, where does that get made? And that occurs in what we call peripheral conversion. You see 85% of that T4 is converted in a peripheral area, the liver, other tissues, into active T3 hormone. More will say where it's needed. What's interesting about thyroid replacement, especially for people who are taking a synthetic thyroid replacement, Synthroid or levothyroxine or thyroxine, what tends to happen is you're only taking T4. And if you have one of the many reasons that the body can't convert T4 to T3, you're going to have great levels of T4, but virtually no T3, and then you'll say, "Doctor, I'm still tired," and they'll look and they'll test you. "Oh, your T4 is fine. You don't need any more." But it's a real problem. So we need to be mindful of that we want to look at all the pictures, not just one specific leg of a stool. When we look at the basal body temperature of a thyroid issue, unlike the adrenal, which we showed a minute ago, you see that consistently a person with low thyroid function is at a very low level, and it's consistently low. It's not like the up and down zigzag that we saw with adrenal. Just a note about this basal body temperature. You see this one starting, this graph is starting at 96, and we want to be up at 98. People always say, well, when do I take this temperature? And what you routinely hear is take the temperature first thing in the morning. The reality is that is not a good time, in my opinion, to take it. If you truly want to know what your real basal body temperature is, what you're going to do is whatever time you normally get up, you take it 3 hours after that time, 3 hours later, 3 hours later, you add the three numbers up, and you divide it by 3. That is the best approximation you'll ever be able to get as far as your true core basal body temperature. However, that's a challenge for people to do, to take their temperature 3 times a day. So what I found clinically, the best way around that is to not take it first thing in the morning, not take it in the afternoon, but take it a little bit before your normal lunchtime. And having done this with hundreds and hundreds of patients and looked at hundreds and hundreds of graphs, because I'd have people take it 10 times, usually over the course of a month, take it any 10 days you want. You can virtually always predict what their core temperature is when you look at when they take it before noon. So that's not what I recommend. Not in the morning, not in the afternoon. Take your one time a day, any 10 days of the month, and what you'll see is there'll be a slight variation, especially in females, because we do know with ovulation there will be a slight increase, but it doesn't really matter. I found it to be an incredibly consistent component of this. So this basically is saying the same thing. You know, your ideal noon temperature is 98.6 plus or minus 0.3. Why? Because this is the temperature at which our enzyme systems to digest food for every metabolic process that happens in our body happens at. This is what we want our core temperature to be. We don't want it to be 96.2. 96.2, it works, but it's like, you know, you're trying to cook a meal in your oven, and instead of turning the oven on to 400, you decide to turn it on to 100 and say, why? My gosh, it's taking a long time to cook this food. Same thing happens in the body when we are not able to, you know, adequately reach the core temperature. Tintera is a physician back from the 30s, way back when, who basically suggested that 60% of patients with low basal body temperature are not hypothyroid. They, in fact, are adrenal dysfunction, which means that for people who are using their basal body temperature as an indicator of whether they should be doing thyroid herbs, thyroid glandulars, or lo and behold, even thyroid hormone, are making a big mistake because they're treating the wrong organ, and potentially they'll burn it out and say, wow, now I really need thyroid hormone. So the major contraindication for ever starting thyroid hormone is an adrenal gland that's out of function. So we know ideally that in order to measure thyroid hormone, you really adequately and properly, we want the cortisol to be in a normal reference range. It's like, how many people are that? So you can just surmise that many people, or most people who've had their doctor test their TSH or whatever with an abnormal cortisol, they'll say, oh, your thyroid is fine, when it's not fine, because what we're ultimately looking at is out of balance in the first place. So this is your typical aspect of you know, your thyroid. Here we see potentially a high TSH, a low T4, low. This is your classic. Oh, your doctor says your thyroid is off. You need to take thyroid hormone or whatever they're going to do. You know, in that particular scenario. So that's your classic hypothyroidism place. Now, in this particular scenario, you have somebody who has a normal TSH, which is coming from the brain, pituitary. It talks to the thyroid gland that says, yep, it can make thyroid hormone. However, the T4 cannot be converted to T3. So that means you can't have reverse T3. So this person is what we call functional hypothyroid. Their thyroid numbers look great on labs, but they feel terrible. They do need thyroid support, or we need to figure out why that T4 isn't converting to T3. This is extremely common, not looked at in many cases by conventional endocrinologists even, because they may be only looking at TSH, that is totally normal, or even TSH and T4, totally normal, because they don't take the third step to get the third leg of the stool. So enough about thyroid. And you know, at some point in the future, you know, we can certainly talk much more, do a whole seminar, in fact, about just thyroid, because it's such a common problem. So the third area we're going to talk about are the gonads, and the ovary in women and testes in men. And this is basically an overview of sort of this basic endocrine physiology. We've been talking about TSH and thyroid hormone. We've been talking about cortisol. ACTH is the activator of that, but you know, we're going to talk mostly about reproduction, ovaries, and testes in this. So, you know, what is estrogen? So estrogens are the hormones, of course, that females mostly have. Believe it or not, men also have it. They're necessary for developing secondary sex characteristics. Men and women, they promote normal bone development. And in women, it's produced mostly by ovaries, which is why you have a lot more than men do. But after menopause, you still need them. You still have those sensitive tissues that need that receptor, that have that receptor. So then the adrenal is supposed to take over. It has many functions, and it affects many tissues. So as I said earlier, there's up to 200 different tissues that are affected by adequate levels of estrogens. Unfortunately, women with breast cancer, are often have a test done to say, oh, your breast cancer is estrogen receptor positive. And why? Because too high estrogens can have a very negative effect on the breast, even though the breast has lots of estrogen receptors. There's estrogen receptors in the vaginal area, in the clitoris, but also multiple other tissues. I said in your bones for making strong bones. It has an effect in your brain. It affects your cholesterol. It affects your bowels. So all these types of things that are going on from this one hormone. When we always have risks and benefits. Some of you, I suspect, are familiar with back in 2002, I think, when the Women's Health Initiative came out with this study that said, oh my gosh, we need to stop giving estrogen and progesterone to women because we have this increased risk of stroke, which is more of a risk than what we're trying to protect by giving women estrogen and progesterone, which were, of course, synthetic at the time. So once again, as this other chart showed, we have benefits of good estrogen levels, balanced estrogen levels with progesterone, but also the risk of too much estrogen, which can come from a number of different factors. Here's another one that says fatigue. So we have fatigue from the adrenal, we have fatigue from the thyroid, we have fatigue from estrogen, but virtually nobody comes in and says, I think my estrogen is off and that's why I'm fatigued, because it's just sort of not in people's consciousness, because they're not aware of how much effect that estrogen have. So obviously our goal is going to be to promote healthy estrogen levels. By diet is one thing. Lead to eating lots of different colored fruits and vegetables, especially cruciferous vegetables. There's an element of cruciferous vegetables that help to balance those hormones. Stress management goes without saying. Some B vitamins are going to support that. The essential fatty acids, your fish, flax, hemp oil are common, and a healthy basal metabolic index as far as obesity and things. Here we have estrogen and testosterone, which people often think, oh, the testosterone is for, the whole idea of libido. It is sometimes, but it's not always the answer. Certainly it's about supporting muscle strength. Men, that's what builds muscle, and women is what builds muscle. It reacts differently in men and women. Women, it's sort of converted at the muscle, and men, it's obviously from their testicles. Their testes that basically makes this hormone. And has testosterone and too much in men is one of the factors that's considered to be associated with benign prostatic hypertrophy, which is often increased urinary frequency, often at nighttime, and unfortunately often associated with prostate cancer. So everything has to be in balance. We look at estrogen as the bad hormone, which it's not. We look at progesterone as the good hormone, which it can be, but it can also be when it's out of balance. It doesn't necessarily the ideal thing. So we have these different phases, especially the women who are listening are obviously very familiar with this. This is what happens during your menstrual cycle. We see in the first part from the very bottom, the hormones are typically low, and then at ovulation, your estrogen starts to go up. Your progesterone doesn't go up until after you've had a surge. You see your basal body temperature raises. You have FSH, LH, etc. So, that's what happens. And then towards the end of the cycle, if a fertilized egg hasn't been implanted into the uterus, then we get a precipitous drop of estrogen and progesterone, which then causes a sloughing of the endometrium. So the number one treatment of menstrual cycle, we've had it for the adrenal, is sleep in the dark. Oh, that's the same thing as a pineal gland. Surprise. Except around the day before, the day of, and the day after the full moon. So what we're trying to mimic here is the gravitational and energetic effect that the moon plays on our Earth, and it does it huge, and on women in specific, but it also affects men for what's going on. So, and these are just some general support things that we can do for people. You know, so we'll rotate seeds, we'll rotate oils, and if women, in my clinical experience, who are coming in often with some issue, meaning it's the spotting, or it's too long or too short or too heavy or cramps or whatever it is, migraine headaches. About 70% of women, if they do this simple seed cycling, can have a very positive impact. And so in the first half of the cycle, meaning the day one or at a new moon is what we consider day one, we can give flax seeds, ground up flax seeds, chia or hemp seeds, usually in about 2 tablespoons a day, you know, added to foods in a smoothie or however they, you know, and on stir fries or grilled vegetables, etc., and on top of salads, as well as some fish or hemp oil in the first half of the cycle. And then when we get to the middle cycle, around ovulation or the full moon, we basically switch the seeds to sunflower, sesame, or pumpkin, lower the dose of the fish oil, and add evening primrose oil. That's EPO. So doing that cycling back and forth following a moon cycle is very helpful for many of these challenges that some women will experience. And, you know, this is just a bit of an overview of suggesting that indeed, based on the different hormones at the different parts of the cycle and the different quarters of the cycle, moods, emotions have a very significant impact. You know, we speak of premenstrual symptoms, you know, which can be anything starting just a couple of days before to a week before to, unfortunately, 2 weeks before, and literally from the whole time after ovulation. So know that that's not, you know, you're not going crazy, and no, you know, you don't need to suddenly be on some type of a medication or anything like that. This is one that most people, including women, are not as familiar with. I learned this from my mentor, who was Dr. Guinot, who was a French physician this is back in the 90s and the early 2000s. And I had observed this in my patients, but I couldn't explain it until I pointed out that your hormones have not only a function of promoting fertility, being able to conceive and carry a pregnancy, but they have a second purpose after menopause. So during from menarche, 12, 13, or puberty, let's say to 52, which is the average in those, you know, 40-year period, there's the potential that a woman could get pregnant. Now, at the end of that, when we start to have a decline of these hormones and lose the ability to have fertility, there actually is a secondary impact that comes with these hormones now being produced ideally by the adrenal gland, which is where they're supposed to be produced. And what Dr. Guinot taught me and explained to me was that if you take supplemental hormones outside of what the body can produce, it totally tempers this secondary function. And this secondary function, what he called this gland of high moral values, what I've experienced is in this period of life for women, for many reasons, not just hormones, but for many reasons, what ends up happening is that their ability to understand and appreciate wisdom and spirituality goes up dramatically. But on women who take hormones, it's blunted, and it's not quite as easy. I won't say it won't happen. It's just, and I had observed that clinically. I always thought that was curious. On the top part of this particular slide, you see that there's, you know, estrogen and progesterone are always in the right balance, and they're precipitously as they decline. They decline in an equal amount. So what I said a minute ago about rotating seeds and oils, people say, well, menstruating, why would I do that? The main reason you continue to do that is because when a postmenopausal woman will continue to cycle for about 5 years as far as these hormones are concerned. Now, you don't produce enough estrogen or progesterone to cause the sloughing of the endometrium, the uterus. However, there is still this balance that we need to maintain. So if a woman comes in and she's 53 and she hasn't had a menses for 2 years and thinks, I'm not going to have a menses, and she's not, we still put her on the seed cycling. But in that case, of course, we're not using her cycle. We're using the moon, full moon to new moon, and then new moon to full moon, as far as the cycling of oils and seeds are concerned. And that will help this second half of the, the component, this I'll call it the level of spirituality that comes when those levels are in the proper balance and when they sort of stay in the proper balance. So these are just a variety of different therapies that we use, similar to balancing thyroid, the thyroid gland, similar to balancing the adrenal gland. And always remember, I said, if you treat one, you got to treat the other two, in addition to that, for what's going on. These are just some homeopathic remedies, some energy remedies that we use to make that particular thing happy. These are other supportive remedies. B vitamins and probiotics sort of are probably always a part of this. We have on the right side of this, we have some very specific type remedies. The lutein, folliculinum are literally hormone, made from the hormone itself. They don't have hormone because they're homeopathics, but they support the body's ability to make the hormones. That's always what we're interested in doing. How do we get the body to do what it's always was conceived to do and perceived to do over a period of time? On the left side, you see all these herbs which have been shown by herbalists throughout the centuries to promote more progesterone. On the right side are herbs to promote more estrogen. So if we're trying to balance progesterone and estrogen, depending which one is deficient and which one is dominant, you will use a different combination of herbs, whether it's in a tea form, whether it's in a tincture form, whether it's in a capsule form, something like that, to try and help support and get these things balanced over time. So a couple of comments about testosterone before we finish up. Testosterone is, tend to be thought of as a male hormone, and indeed is. However, women need and have testosterone just like men do, but just as men do not have the same amount of estrogen, women do not have the same amount of testosterone. So in the fetus, it's necessary testosterone and its metabolite DHT are necessary for the formation of the internal and external male genitalia. At puberty, testosterone is for the male characteristics, the deepening of the voice, the stimulate sexual behavior, initiate sperm production, and that kind of thing. But in an adult, once that is there, it maintains muscle mass and also bone mass, which is why it's important to try and maintain a healthy level of testosterone. And just as I said, with estrogen having many effects on many tissues, the same thing is true for testosterone. We see it has, in the fetus, it has a component. In the adult, it has a component. At puberty, it has certain components. And bones, muscles, body fat, cholesterol, etc., are significantly impacted by the effect of testosterone over time. We see many ads. There's labs that have basically been formed talking about erectile dysfunction. They're talking about low testosterone, which is great from the aspect if that's indeed true. However, there's been a number of studies suggesting that the value of when you just measure testosterone, you can't rely on what the lab said, because these are numbers that supposedly should put us in a reference range, of total free and bioidentical. But what we have, so we're testing circulating testosterone. It's not what is your total testosterone, what is the amount of active testosterone, just like we want active thyroid hormone. So it has a number of different, the bioavailable is the part that we're most interested in, not just how much testosterone you have in your body. So, men and women, obviously, you see men have a lot more than women do, which is expected, obviously, and there's a secretion, 8 times a day, peaking at 8 and lowest at 10. So, several times a day you get this burst. It's not just like, oh, you take testosterone and this is what happens to it. No, it's this, because that's the way our endocrine system is supposed to be working. We know that between 25 and 50, the testosterone levels start to decrease. It's part of aging again. It's like, oh, so should a 75-year-old have the testosterone of a 25-year-old? That's what the suggestion is, because they say it'll be anti-aging. However, what else are you doing to your body? You throw one hormone so far out of balance, how does it keep in the picture of everything being in balance? As we say when we started, balance of hormones is the correct component of making these hormones the most helpful and the most effective and helpful for people. We do know that a single low value does not necessitate that, oh, you should be on some form of testosterone replacement. We know that up to 30% of men will be normal on a repeat measurement. So just 1 in 3, it's like, oh, just remeasure the number. So there's no doubt that it does decrease in time. This is literally same person, 4 different samples, and you see what happens over a period of time. So never, for a man who's being checked, should one single measurement be utilized, especially if it's not in the morning, to truly understand what their testosterone level is. So, if there is a problem, it has to be drawn in the morning, simply because of what's going on. Acute illnesses or other reasons must be addressed first. We need to look at what is bioavailable. That showed up 8 years ago, that particular study. So we also have, some other aspects of, if it is low truly and we need to support it and the patient responds, then we'll monitor appropriately to make this work. But if there's no effect within a couple of months, it's not going to be any value. So these are all the tests that should be done, not just, oh, what is your total testosterone? And that sort of tells you the piece, because, once again, hormones are all about balance. It's not one hormone. It's no sense just testing TSH. What does that tell you? It's no sense just testing total testosterone. What does that tell you? No sense just testing cortisol. What does that tell you? We need all these in balance to try and get a better sense, which is what biological medicine obviously is promoting. It's promoting balance in all hormones. That's what we're attempting to achieve for people. These are the main target organs that we see in a man. Bone, again, sex organs, the liver, the skin, the brain, the muscle, the kidney. So it is important that we have adequate levels. So just imagine a man being treated for prostate cancer who either had testicles removed, or more often now they're on Lupron, which basically stops the secretion. So they have no testosterone. They have all these tissues needing it, and they wonder why they have so many adverse effects. They don't feel well, they can't think, they can't function, they lose muscle strength, they can't do what they normally did. Their kidneys start to be more taxed, their bone marrow starts to break down, etc. And so obviously it's some associated, sexual organ challenges. So this is what we see over time with the levels decreasing in time. That is unfortunately true. These are our common symptoms, but they're no different than too little or too much estrogen. They're no different than too little or too much progesterone. They're no different than cortisol. They're no different than thyroid. They're no different than somebody who's Lyme disease. There's no different than somebody who's chronic fatigue. There's nobody different than somebody who has gluten, celiac disease, or hypoglycemia. In other words, there's such a broad base of symptoms. If you go in with the idea that the problem is testosterone because you have these, oh, of course, we can find it if that's what we're truly looking for. But if you don't look at all the pieces, how are you going to really know what the real problem is? How are you going to really find the root of the problem? And that truly is what we're most interested in doing. Again, here's the laundry list of that. And people say, oh, I have this, 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 and this. I must have low testosterone. But if you read the estrogen thing, oh, maybe it's an estrogen problem. Oh, maybe it's a cortisol problem. Oh, maybe it's a thyroid problem. Oh, maybe it's a growth hormone problem. So don't just pin it on by reading a list, going on Dr. Google, who knows everything, and saying, what are the signs of a low thyroid hormone? People read it and say, oh, I must have low thyroid. Not necessarily. In fact, most people, it's not their thyroid that they need to look at, it's their adrenal gland. So testosterone replacement, of course, is commonly done. However, it should only be done truly if you've looked at all these things, looked at all the pieces of the puzzle and saying, aha, indeed, this is low, we need to do something about it. let's support it in some way to try and restore it to at least the minimum level of support. So, you know, of course, if you have these types of symptoms, doing these types of things should potentially improve what it is you're feeling. But of course, many men will do that. They'll do it for a few months and say, I don't think there's any difference, which obviously means that wasn't the problem, even though it looked like it was, but they didn't evaluate the whole picture. And that's truly what we have to always be mindful. What does the whole picture say? Just not what does a single number say for any one individual. These are ways that it's delivered. The gels are probably the more common, or the injection. What we never want to do. So here's sort of risk things. You know, some degree of concern, some precautions that come when people do a testosterone replacement. It can be certainly a concern and a problem. What this is the main thing: hepatotoxicity, liver toxicity. We never ever. Hopefully, you don't know any men, you don't know any people who take oral testosterone. Is not indicated because of safety factors, and so my suggestion is you never want somebody using oral testosterone. It can be delivered when appropriate in more beneficial ways through a patch, which is a common way that it's being given. You know, once again, we want to measure things and make sure we're doing the right things. 2015, the ADA, not the ADA, the FDA said, you know, there may be some challenges with testosterone, including an increased risk of stroke and heart attacks. And you see the list. My gosh, so look at all those adverse effects that come from potentially either the conversion to more estrogen, or an overstimulated libido, or acne, or excess of, you know, male breast development, etc. So there are definitely other problems, and men can have too much estrogen because the testosterone combines with and the aromatase enzyme, which produces estrogen when and where needed, and estrogen-sensitive areas, including the brain, that can be affected. And so there is a problem with too much, because this displaces testosterone off the receptor sites, literally turns off the testosterone, and unfortunately sometimes it stays stuck in that off position. So, you know, we have a number of things which will produce that: aging, liver function. You know, the liver, you have to always talk to your liver and say, oh, nice things to it, because it's such an important organ. Obviously, alcohol abuse, drug abuse, etc., are things that contribute to that. You know, testosterone for women are often put in a formula that they have or that they use, thinking that for some women that may be supporting libido. I would say equally number of studies says it may or may not. So it's like, maybe it'll help, maybe it won't. If you need to try it, give it a try. We do know it also interacts with other medications, as what drugs don't, or what issues don't. So there are also potentially, for men, if they don't want to actually do the testosterone, we can do zinc, and the proverbial aphrodisiac food of eating oysters is supposed to, you know, supposedly improve your libido. We know vitamin D should be at least 50, which is a challenge for many people, because even living in a very sunny place like Arizona, we see many people who don't make it to 50, because with the sun out so much, we go out early in the morning, later in the evening, when the maximum effect you get from vitamin D isn't there. So sugar, more fruits, more vegetables. We know that exercise is a positive thing. Always stress management is a positive thing. And there are several patented products that contain products like arginine and fenugreek and oats, avena sativa, and beetroot, etc., and tribulus, that will support those types of things, you know, that a person has. Some basic vitamins again. So if you're using basic minerals and basic B complex, a lot of these endocrine problems will, at least on some level, be supported. We know zinc is another one that potentially can be very supportive and helpful. So if nothing else, just from general support, if your male partner is, you know, wanting to support hormones in some way, then these are very reasonable things to be supporting. B vitamins may have to use the active B because of methylation issues, but just talk to your physician about whether that's an issue for the MTHFR SNP, we call it, for what's going on. So that's the end of this formal thing. And I'm going to ask if you mentioned having organs removed disrupt Does this include tooth extractions? And the answer is yes. It's a great question. And the reason it does include teeth is because every one of our 32 teeth are connected via channels and meridians to different points on the body, including the endocrine glands. So having a tooth extraction or extractions, especially ones that are related to the different endocrine glands, by all means can disrupt that. So another factor to play, and another reason to be mindful of, biological dentistry, of how important that is when we're tying biological dentistry to the whole idea of biological medicine. We're not separate entities. We need to totally work together. It's totally a unit. What happens in your mouth happens in every other body part. And, whether it's a root canal, whether it's an implant, whether it's a need to have it removed and extracted, an open space, fillings, etc., can be great disruptors of energy in the mouth, which can be great disruptors to the different organs. A great question to be asked. If anybody else has any questions, let's see if there is any other questions. First of all, I have to do something here. Any other things came in? Oops. No, it doesn't look like no more questions. Okay, so then what I want to suggest is a reminder that on Thursday, May the 24th, same time, same place, we're going to be doing a presentation on the immune system. I think the immune system is poorly understood. I think people think of the immune system as, oh, do I need to get, I get a flu shot? Or if I get sick all the time, my immune system mustn't be working. If I have an autoimmune disease, my immune system is overactive. In fact, it often isn't. It's just out of balance. If I get cancer, does that mean my immune system isn't working? It's not just the immune system. So I think there's a lot of misinformation out there about the immune system. So I hope to clear up a little bit of those challenges that people have, or misunderstandings that people have. I believe, and Heidi can correct me if I'm wrong, but in time, this particular presentation that we did tonight will be posted. If you think the information was of some value, or somebody who would benefit from listening to this and trying to create some understanding of their endocrine system before they actually step out and say, yeah, I need to talk to a biological practitioner to try and really figure out all these pieces, to make it work. So yes, Heidi just told me that yes, it will be down, and I'm assuming it will be on the BRMI website. Heidi, is that going to be correct? Yes, that's where it is. So brmi.org. In fact, you're going to find other ones that we've already done, including the last one and future ones. You can start going there for what I believe is a good source of information about this type of an approach to medicine. And we're not trying to fix your symptom. We're trying to help you understand for what's going on. So the specific website that the http brmi.online, one word, /webinars. So brmi.online/webinars is where you will see some of these presentations. And I highly encourage you to share them with people share them with people who may think that they have an endocrine issue, may they think they may have a thyroid issue, when in fact it may not be a thyroid issue. It may be the reason that they don't feel that they're improving, doing what they're doing. But we'll talk about this one. But once again, share with your friends, because I'd love to meet with you again in a month from now on the 24th of May. And once again, we'll be talking about the immune system. Thanks for your time. Thanks for joining us this evening. If you have any feedback, good or bad, please pass it along. Our goal is to create an educational resource for you, to give you as much possible information as we possibly can. Because we think that's how everybody will basically be in a better place. And if we can help you reach a higher level of optimal performance, which is what our goal is, then we think everybody will be the winner. So good evening, everybody. If you're in the West, you're still dinner time. If you're in the East, it's getting close to, not bedtime yet, hopefully at 8:30, but you'll be getting there. All right, we'll talk to you all in a month. Thanks for joining us. It's been a pleasure. Good night, everybody.